Di nagtatapos sa 4 na sulok ng kwartong ito ang kwentong top rank. Mag-aaral, magsasaya, at higit sa lahat, magta-top sa board exam. Dahil sa top rank, pamilya kami.
So always remember, ang dami niyong opportunities, okay? What we offer in Asian is, you tell us what to do, and we will make it happen for you.
Don't ever let somebody tell you that you can't do something. Not even me. You gotta dream, you gotta protect it. You want something, go get it. Here.
Be confident. You have that knowledge. Later on, ang tanging hihilingin mo na lang ay enlightenment.
Congratulations, top rank RNs.
Rankers, congratulations. Kino-congratulate ko na kayo lahat kasi alam ko mapapasa niyo lahat yan dyan sa board exam na yan. And not only just pass it, but really with flying colors.
Gusto naman ng maaga, kala ko araw ay sinada.
Hi, we're the ones and we're wishing you good luck sa inyong exam. Alam kong lahat ng hard work nyo ay magpipay off at sana lahat ng narinig nyo ay maalala nyo. At ngayon pa lang, kino-congratulate na namin kayo. Congratulations dahil alam ko na kayo ay papasa at mapapabilang kayo sa mga top notchers this year. So congratulations in advance, top rank RNs.
Our first runners-up. The world is full of successful failures. Many of the most successful people overcome setbacks and disappointments to reach the top. Be the tenacious and the old-fashioned alchemist who turned metal into gold. Success is a state of mind. Always tell yourself, I can get through this. I will get through this. I must get through this. Saturday is your big day. Don't lose your chance. Live that day as if it were your last day. Your time is limited. Do not waste it living someone else's life. Know what you want in life. Define your own success and stop at nothing to achieve it. Don't ever let somebody tell you that you can do something. Not even me. You got a dream, you got to protect it. You want something, go get it. Period. What is your goal, class?
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard to outshine the rest. with a great mind and compassionate heart. A home that trained us to be the best we can be. All that we learned at Top Rock Review Academy. We shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that if you want to top rock, if you got it, soar to the sky.
Good evening po sa ating lahat. Mag-start po tayo at exactly 6 p.m. Masabi po sa mga kaklase, pasok na. We have 100 items to rush off for 2 hours. Tips for boards daw po. Kasi meron pa tayong 4 minutes. Ano ba? Ano bang tips for boards po? Read the question carefully lang, guys. And then always look for keywords. Kasi minsan, keywords lang talaga. Minsan, isang word lang from the question, alam mo na yung sagot. Hope you're okay na, ma'am. Thank you. Gulay na po. Medyo gulay na. Ilan po scores nyo sa mga recalls nyo po, ma'am? Recalls 1, ko is line of 4s. Mga line of 4, 45, 43, 47. Pero nang umabot na ng recalls 8 to 9, nasa line of 9 na po ako. 94, 95, 96, recalls 9. Ilan na bang mga scores nyo ngayong recalls 9? Mababa ang pre-board 1 ko, pero top 10 ako sa Cebu. Nagtatop ako sa mga pre-boards, pre-boards 1, 2, 3, pero hindi ko pa din naisip na magtatap ako sa totoong boards. Pero ang sabi ko kasi, ilang percentage lang naman kami dito sa Cebu kasi sa buong Pilipinas. So hindi pa din ako naging kampante. Kahit na nagtatap ako sa mga pre-boards. Nanganganib po ba pag nasa 60s yung score? pag sa recalls, at least kahit nakaka-70 and above ka, safe na safe ka na eh. Ganon. 70 and above, safe ka na. Kasi yung mga recalls nyo, ganyan-ganyan yung mga tanong sa board exam, promise. Yung mga nakikita nyo sa recalls nyo, ganyan na ganyan sa board exam. Ano po yung mga binasa nyo pong book, ma'am? Sa MS ko, ang pinaka number 1 source ko talaga si Ma'am Udan. Si Ma'am Udan po talaga kasi napaka-Filipino-based. Hindi ako nag-Saunders, guys. Kahit sinasuggest sa amin na mag-Saunders, never ako nag-Saunders. Hindi ako nakahawak ng kahit isang Saunders na resources. May mga notes. Madami akong notes kasi sinasummarize ko lahat ng inaaral ko eh. We'll start at exact. Mag-share screen ako at 6 p.m. Meron naman po tayong 2 hours. Hindi naman po masyadong mahirap yung NP5. So, maybe we'll have time later kung may questions pa kayo. Nag-enroll ako 11 months program, pero hindi naman kami naka-isakto ng 11 months, so 10 months lang. And face-to-face ako ng 3 months sa Cebu. PB1 ko, mababa po, 205. 205 ang PB1 ko. Top 10 siya dun sa Cebu. Top 10. Wala akong supplements na tinake. Prayers lang, guys. Mag-share screen na po ako. It's 6. Okay. Yan. Nakikita na po ba ang screen? Okay. Let's start tayo guys. This is your Recalls 9 and P5, 1 to 100. Ready na ba ang lahat? Situation, Melanie is a 26 years old, diagnosed with major depressive disorder. She had been prescribed with other antidepressants, but she only seems to respond to monoamine oxidase inhibitors or MAOI. The nurse strictly emphasizes health teachings on patient Melanie taking MAOI. Chikahin natin ng konti ang iyong MDD, major depressive disorder. MDD. Ang cause ng MDD mo is decreased level ng monoamines na norepinephrine, serotonin, and dopamine. Nagkakaroon ng symptoms of, okay po ba yung sounds? Are we good, guys? Yes po, okay. Nagkakaroon po ng symptoms of depression pag may decreased level ng iyong norepinephrine, serotonin, and dopamine. Meron tayong enzyme na natatagpuan sa nerve endings na tinatawag na MAO. Ang function po ng MAO, monoamine oxidase, is dinidestroy niya po ang norepinephrine, serotonin, and dopamine. Ito po ay mga monoamine. Kaya hindi naman po masyadong kailangan madami ang kailangan ng katawan. But for patients na mababa ang level ng norepinephrine, serotonin, and dopamine, ini-inhibit po natin ang destruction nito ng MAO para tumaas ang level and to relieve the symptoms of depression. Kaya nagbibigay po tayo ng tinatawag na MAOI. Monoamine oxidase inhibitors inhibit the function of MAOI. So kung wala pong MAO, pag nagbibigay tayo ng MAOI because it inhibits the function of MAO, tumataas po ang level ng iyong norepinephrine, serotonin, and dopamine. At nare-relieve po ang symptoms ng iyong major depressive disorder. Nagets po ba ang part na yon? Okay. Question number 1. The biogenic amine theory of depression states that depression is a result of, sinabi na natin kanina, depression is a result of deficiency ng iyong norepinephrine, dopamine, and serotonin. Letter C. Number 2. All of the following are drugs under the classification of monoamine oxidase inhibitors except. Madali po nating natatandaan ang mga gamot under MAOI dahil itinuturo po ni Sir Kenneth na pag MAOI ang iisipin natin money, pamana. Yes po. MAOI, money, parnate, marplan, nardil. Ang hindi po kasali is tofranil dahil ang tofranil po is what? TZA. Tricyclic antidepressant po ang iyong tofranil. Number 3. What is the priority nursing diagnosis? I-box mo to. Related to drug therapy of patient taking MAOI. Pag pinag-uusapan natin ang priorities, palaging pumapasok sa atin ay ABC. Meron po ba tayong airway problem? Wala. Breathing problem? Wala. Circulation? Meron po. Decreased cardiac output. Bakit po decreased ang cardiac output? Dahil po pag nagtitik ng MAOI, tumataas ang level ng ng norepinephrine. Ano pong function ng norepinephrine? Ito po yung nagko-cause ng vasoconstriction and increased cardiac contractility. Kaya meron po siyang cardiovascular effect. And this can lead to decreased cardiac output. Yan po ang ipa-prioritize mo because yun yung threatening to the patient. Hindi deficient knowledge, acute pain, disturbed the process. Pag priority nursing diagnosis, it's always physiologic over psychologic. Number 4, the nurse might question an order for a MAOI as a first step in the treatment of depression. Hindi po kasi natin unang ibinibigay ang MAOI. TCA is usually a last resort pag ang patient po is hindi na nagre-respond sa ibang mas magandang antidepressants such as SSRI. Remembering that these drugs are reserved in use in cases pag hindi na nag-respond ang pasyente. Question, Bakit daw po? Remembering that these drugs are reserved for use in case which there's been no response to other agents. Because, bakit po last resort ng iyong MAUI? Letter B. MAUIs are associated with potentially serious drug-food interaction. Ano po yung meron? Ano po yung meron? Hypertensive crisis due to what? Tyramine. Risk for hypertensive crisis with ingestion of tyramine-rich foods. Ano po bang meron sa tyramine? Ang tyramine po is para po siyang norepinephrine. Parehas po ang function nila. Ang tyramine po is bini-breakdown din sa GI tract pa lang. Pag kumain ka ng tyramine-rich food, ang tyramine-rich food po ay bini-breakdown din ng MAU sa GI tract pa lang. So kung ang patient mo ay nagtitik ng monoamine oxidase inhibitor, wala din pong nag-breakdown sa tyramine mo. So ang nangyayari, tumataas din siya. Ang problema, ang tyramine mo po ay parehas ang function niya sa iyong norepinephrine. So kung mataas na po ang level ng iyong norepinephrine dahil nagtitik ng MAUI, at tumaas din po ang iyong tyramine dahil nagtitik ng MAUI, together, magkukos sila ng hypertensive crisis. Dahil hindi lang po basta na magparehas ang function ng tyramine at norepinephrine mo, kundi tyramine also stimulate na mag-release ng stored norepinephrine sa mga nerve terminals. So imagine kung gaano ka-risky na hypertensive crisis ang pwede niyang ibigay sa patient mo. So nagbibigay lang tayo ng MAUI as a last resort pag hindi responsive sa ibang antidepressants because of serious drug-food interaction. This is NP5 po. NP5 recalls 9, number 4. Number 5 na po tayo. Number 5, which of the following indicates that the client needs further teaching? Negative ang hinahanap natin. Letter A, I will have to avoid drinking wines. Tama po ito dahil ang wine ay aged drink. Tyramine-rich po ang mga aged drinks and food. I will be able to eat ricotta cheese without worrying. Tama po ba ito? Yes po, ang ricotta po ay safe cheese together with cottage cheese, together with cream cheese. Mga safe cheese po sila. I can eat green beans, yes po, dahil ang green beans ay unripe vegetable. Ayaw po natin ng ripe dahil rich po sa tyramine ang mga ripe. Gusto po natin yung mga unripe vegetable and fruits. Ang mali po dito is letter D. Ayaw po natin sa cheeseburger dahil po ang mga patty sa burger ay they are stored. Stored po sila. Pag stored foods, mataas po ba ang tyramine? Yes. And the cheese sa burger is not specified. Hindi natin alam kung safe or hindi. Number 5, dog. Situation for number 6, 19 years old Kiara was immediately brought to the hospital from the school clinic after he suffered from seizure. He suddenly slumped to the floor. Nagkaroon siya ng full tonic-clonic seizure and he was diagnosed with idiopathic generalized epilepsy with tonic-clonic seizure. Number 6 question, Kiara was admitted to the hospital for further assessment and monitoring. Lahat daw na precautions dapat mong gawin as a nurse except negative ang hinahanap. Oxygen and suction apparatus at the bedside, yes po, dahil for episodes ng seizure, nagkakaroon po ba ng oxygen deplete and hypoxia? Yes. Always raise padecidal safety purposes. Avoid noise to avoid trigger ng seizure episode. Mali po ang letter C. Ayaw natin ng bright lights dahil ito po ay pwedeng mag-trigger ng seizure. Number 6, letter C. Number 7, a tonic-clonic grand mal seizure is characterized by tonic-clonic ang tinatanong sa'yo. Ano daw ang meron pag tonic-clonic ang seizure? Meron tayong dramatic tonic-clonic muscle contraction, may relaxation appearing as aggressive spasm, loss of consciousness, and recovery period. Ito pong letter A, ito po ay absence. Absence seizure. Ang letter C naman po, very high fevers. Ano po ito? Febrile seizure. Pag-cause ng very high fever. Ito naman pong nagbibigin sa one area ng brain, tapos pumupunta sa ibang parts ng brain. Ano po ito? Jacksonian. Jacksonian. Number 7 is letter B. Number 8. While patient was inside the bathroom, he suffered another sudden seizure episode. Nag-seizure sa loob ng banyo. The nurse was immediately alerted and responded. Ano ang priority nursing action mo? During seizure, dalawa po ang priority natin, guys. Ano po yung dalawang priority natin sa seizure? Safety and airway. Safety and airway. Very good. Yan po ang dalawang priority natin during seizure. So, eliminate na natin yung transfer. And ayaw natin i-hold title yung patient dahil restraining yan. Bawal na bawal yan. So, put safe air in the bathroom or open the airway. Ano pong sagot? C or D? C or D? Letter C. Bakit mali ang D? Hindi po tayo nag-open ng airway sa patient na nagsisisure by trying to manipulate and open the mouth. Bawal na bawal po yan. The only thing we can do to ensure na open ang airway ng patient na nagsisisure, put the patient into side-lying position. Ang priority mo dito, ilagay mo sa safe area dahil nasa bathroom, pwedeng mauntog habang nagsisisure. Number 8, C. Number 9. What patient education must be emphasized by the nurse concerning safety in relation to the side effects of anti-epileptic drug. Ano po ba ang nangyayari pag nagtitake tayo ng anti-epileptic drug? Nagkukos po ito ng sedation and drowsiness. Sedation and drowsiness. To alleviate GI tract, hindi po nagkukos ng GI irritation ng anti-epileptic drugs. Hindi, my fatigue and malaise does not address safety. Hindi din po to. Ang only option that address safety to the patient is letter D, avoid operating dangerous machinery and performing tasks that requires alertness dahil nagkukos po ng sedation and drowsiness ang anti-epileptic drugs. Number 10. Hydantoins was prescribed for the patient for treatment ng tonic-clonic seizure. Nagbigay ng hydantoin. Ano po ang pinaka-common na hydantoin na alam natin? Phenytoin, dilantin. Ito po ang pinaka-common na hydantoin na yes, phenytoin. Tama. Dilantin. Anong adverse effect na alam natin na sikat na sikat? Letter D, gingival hyperplasia. Number 10, number 11. Personality disorders na po tayo can causes problem in the pattern of behaviors leading to disruption in interpersonal relationship. Number 11, the client is stated to the nurse, "You're better than my family and the doctors. You understand me more than anyone else," sabi ng pasyente. Sabi naman ni nurse, "I'm interested in helping you get better just as the other staff members are." Ano ang ginagawa ni nurse? Hindi siya nag-observe, hindi siya nag-offer ng sarili, hindi niya basta kino-comfort yung pasyente, nag-i-establish siya ng boundary by reminding the patient na she is doing her job just like the other professionals in the field. Establishing boundaries, number 11. 12. Clients with borderline, BPD ang pinag-uusapan, borderline personality disorder, often react to situations with extreme emotional responses without actually recognizing their feelings. The nurse can help clients recognize negative thoughts and feelings, replacing them with positive patterns of thinking. Ito po yung tinatanong. Ano daw pong technique ito? Recognizing negative thoughts and feelings and replacing them with positive pattern of thinking. Ang thought stopping, ito po yung sinasabi ng mismong bine-verbalize ng pasyente pag may pumapasok ng mga negative, sinasabi niya, stop. Yun po yung thought stopping. The catastrophizing is like, iniisip mo realistically kung ano yung catastrophe that will happen. Positive self-talk, ito po yung sinasabi mo na, okay, nagkamali ako pero kaya ko to. Gagawin ko ang best ko sa susunod na pagkakataon. Ito pong constructive cognitive restructuring ang ating sagot kung saan may negative thoughts na binapalitan natin ng positive patterns. Rinireconstruct ang way of thinking. Number 12D. 13, clients are often at a loss about how to manage unstructured time. They become unhappy, ruminative, and engage in frantic, desperate behaviors para ma-change yung situation. Anong intervention na pwede mong gawin para ma-minimize ang unstructured time ng pasyente? Set time and activities for the client is no, because hindi po ito magpro-promote ng autonomy kung ikaw ang mag-set ng activities sa kanya. Physical sports is no dahil po napaka-manipulative ng ating BPD patient. Let the client engage in any activity is wrong. Let the client make a written schedule of activities is the correct answer. Dapat ang client mismo ang gumagawa ng kanyang schedule. And according po sa libro ni Ma'am Shella Videbec, ni Tita Videbec, they are more likely to follow pag written form, yung literal na written, na sila yung nagsulat. Number 13A. 14. Shirley was upset. Umiiyak siya after her boyfriend did not pick up her call for the 8th time. Umiiyak siya kasi hindi sinasagot ng jowa niya. She began to run the razor blade across her arm. As the blood trickled out, kumalma na siya. What is the nursing diagnosis for a patient manifesting this kind of behavior? Hindi impaired resilience, hindi ineffective coping skill. B or C? C po ang sagot. Ang self-mutilation is defined as behaviors na nag-i-indicate ng potential for deliberate physical damage, pero hindi po intended to be fatal. Ang purpose lang po nito is to attain relief of tension. Yun po yung ginagawa niya. Natitense siya, sinasaktan niya ang sarili niya, pero the moment na na-relieve na yung tension, humihinto na siya. It's not meant for suicide. Number 14, C. 15. Shirley tend to adore and idealize Nurse Erica, stating that she is the best of. Sabi niya, ikaw ang pinaka-best nurse dito. But after Nurse Erica reprimanded her, pinagalitan siya dahil inaway niya yung isang pasyente, she quickly devalues her. Ano ang tawag sa defense mechanism na ito? All good, all bad, no gray area. Anong tawag natin dito? Splitting. All good, all bad, no gray area, splitting. Number 15, Joe. Situation is Steve found himself in the local jail again after being arrested for burglary. He had been found in and out of the jail in the past 3 years. Siya ay may antisocial personality disorder. Tapos na tayo sa BPD, antisocial na po tayo. Number 16, the client approached the nurse flirtatiously. Flirt niya yung nurse and attempt to gain personal info. The nurse intends to set limit by stating behavioral limit. Paano daw po mag-state ng behavioral limit? Letter C, we need to use this time to work on solving your job-related problem. Ito po ay identifying the expected behavior. Ina-identify kung ano dapat ang behavior ng pasyente. Identifying expected behavior. If you continue, I will terminate our interaction. Ito po ay identifying consequences ng negative behavior. Identifying consequences. Ang yun pong letter A is, it is not acceptable for you to ask personal question is stating behavioral limit. Sinasabi mo kung ano ang tama at limited behavior na dapat ipakita ng pasyente. Number 16A. 17. The nurse saw Steve having what seemingly an intense conversation with the other patient, and the other patient looks agitated. What is the appropriate action ng nurse? I-commend mo siya, mali naman yung ginagawa mo, hindi mo siya pwedeng i-commend. Reprimanding will not help, mag-aaway lang kayo. Join the conversation, hindi po. Correct answer is letter C. Distract the client and have the client return to his room. I-distract mo lang siya, wag mong awayin, and then pabalikin mo sa kwarto. Because clients with antisocial personality disorder, they are manipulative and they exploit those people around them. Number 18, one of the primary nursing diagnoses for clients with APD, antisocial, is ineffective coping. Ineffective ang coping, as evidenced by magagalitin, low frustration tolerance, at impulsive behavior. Ano ang priority nursing intervention mo in helping the client cope with situation? Mabilis po. Babagalan po natin. Okay. Ano ang priority nursing intervention natin? This won't help. Ang ina-address natin dito ay yung ineffective coping. Ano ang intervention mo for ineffective coping? Pwede to, pwede to, pwede to. Pero ano ang priority mo? Ano ang una mong gagawin? Letter B po ang sagot. Evaluate the ability to understand events. Have time to screenshot. Ano po yung gusto nyo? Yung parang 1, 2, 3 SSD? Ganon? 1, 2, 3, 1, 2, 3 SSD. Okay. Okay, sige po. Gagawin natin yon. Bakit po kailangan natin unahin ang pag-evaluate? Because this is assessment. So magkukontest po tayo between A and B. Evaluate the client's decision-making ability or evaluate the ability to understand event. Ito po yung dalawa nating assessment, A and B. Ang uunahin mo dito, ang priority mo is evaluate the ability to understand event. Because the moment you know kung ano po ang level ng understanding ng pasyente, madidetermine mo yung degree of impairment niya. The moment na-determine mo yung degree ng impairment ng pasyente, ma-identify mo on how and where to start in helping the patient. Kaya nga po sa ibang nursing intervention, palagi nating priority ang assess level of understanding. Parang rewarding lang po ito. Evaluate the ability to understand events. Number 18 is boy. SSD na po tayo for number 18. 1, 2, 3, 1, 2, 3, SSD. Number 19, okay na po. 19. Steve approached the nurse. Steve approached the nurse on duty asking permission to go out for the night. Mag-chill tayo ng konti ngayon dahil may 2 hours tayo for 100 items. Steve approached the nurse on duty asking permission to go out for the night. He reasoned that he had been a good patient. Sabi niya, mabait naman ako, palabasin mo ko ngayon lang, just this once. Steve has not merited kahit hindi niya naman deserve na lumabas. Paano ka magre-respond kay Steve? How dare you think that you can go out tonight? Ang taray mo naman. I'm going to call your doctor to ask if you go out for the night. You must wait. Hindi po. Since you've been behaving doing good lately, nagpa-manipulate ka sa pasyente. Letter C, simply state the requirement in a matter of fact, avoid arguing. Sabihin mo lang sa pasyente, you have not merited any privilege of going out, therefore dito ka lang. State the requirement matter of fact manner. Number 19, C. SSD 1, 2, 3, 1, 2, 3, go. Number 20. After months of collaborative interventions and behavioral management, si Steve daw ay na-release na sa mental institution. The nurse continually evaluate the client to ensure success of treatment. Nasaan sa options ang nagpapakita ng consistent, successful treatment kay Steve? May recent fights another employee, mali. The client's family said na hindi daw umuuwi ilang buwan na, mali. A month after discharge, na-arrest ulit siya dahil may physical assault, mali. Correct answer, letter D. He has developed meaningful relationships with the other members of the group therapy na pinag-reference sa kanya. 20, dog. Ay, SSD pala. SSD, go. Ano daw ang meaning ng SSD? Ano ba yung meaning? Alam ko lang may screenshot yan eh. Parang pa-screenshot. Pero hindi ko alam kung anong meaning ng mismong screenshot done. Okay. Screenshot done pala siya. Screenshot done na po, number 21. Mr. Jones is the chief executive officer of a large company and has been experiencing acute anxiety. Anxiety na po ang ating pag-uusapan. Normal ang physical exam and he was diagnosed with anxiety. While attending in one of his meetings, Mr. Jones felt increased tension in his muscles and was sweating profusely. Sweating, keyword mo to, and inattentiveness, keyword mo to, because of how frequent you have to call for his attention. Anong level of anxiety? Pagbasa, basa, basa. At my inattentiveness, selective ang attention, ano yan? Moderate po. Moderate. Basa po tayo dyan dahil parasympathetic response, pag moderate, diarrhea, urinary frequency, salivation, diaphoresis, at mayroong selective attention ang ating moderate level of anxiety. 21B. SSD, SSD, 1, 2, 3, go. Number 22. Considering his occupation, kasi CEO siya, and his need to be alert, kailangan niya being alert and present in a large groups on a regular basis. So ang kailangan niyang anxiolytic is yung dapat helpful sa kanya. The following anxiolytic would be a drug of choice for Mr. Jones. Ano po ang magiging helpful kay Mr. Jones? Ang phenobarbital mo po is barbiturate. Barbiturate. Ang iyong diazepam po is benzodiazepine. Benzodiazepine. Barbiturate din po ang iyong, benzo din po ang iyong clorazepate. Meron po tayong dalawang drug class, 2 drug class ng anxiolytic. Yan po sila, yung barbiturate at yung benzodiazepine. Pero may mga bago po tayong anxiolytic. Oh my gosh, bakit hindi siya gumagana? Meron po tayong mga bagong anxiolytic na hindi nabibilong sa group na ito. Dahil ito po yung mga lumang anxiolytic, barbiturates and benzodiazepines. Ang correct answer po dito is yung sikat na buspirone, buspar po ang kanyang brand name. Ang buspirone po is bagong anxiolytic drug na hindi siya, it's not either barbiturate, it's not benzodiazepine. Ito pong anxiolytic drug, unlike benzodiazepines and barbiturates, wala po siyang CNS effect. No CNS effect. Therefore, hindi po siya nagkukos ng sedation. Kaya ito po ang ating preferred anxiolytic for busy people like Mr. Jones. Number 22, D. Number 23. Nurse Karen is a newly registered nurse assigned in a psychiatric ward. Siya ang nag-handle kay Mr. Jones. Prior to interacting, pag sinabi nating prior to interaction, ito po ay pre-interaction phase. Ano ang initial nursing action? Alam na alam natin to, self-awareness. Nasaan sa option ang self-awareness? Ay, nakalimutan ng SSD. SSD, SSD, let's go. Number 22. Nasaan ang self-awareness? Letter C, determine own level of anxiety. Palaging gagawin ang determining of own level of anxiety prior to interacting para hindi mahawaan ng anxiety ng patient because anxiety is what? Na ipapasa yan. Number 23C, SSD, SSD 1, 2, 3. 24. During one of their sessions, Mr. Jones' anxiety suddenly spiked up and he was having a panic attack. Nagpanic. Ano ang priority nursing action mo? Priority mo dito, safety. Pag nagpa-panic attack, wala kang ibang priority kundi safety ng patient. Paano mo may ensure ang safety ng patient? Hindi ka magre-restrain, hindi ka makakapagbigay ng anxiolytic at that time, at hindi mo priority tumawag ng iba. Remain with the patient dahil pag panic yan, hindi mo alam kung anong pwedeng gawin. So to ensure safety, remain with the patient. Number 24, C. SSD, SSD, let's go. Number 25. The physician prescribed alprazolam for Mr. Jones, and Nurse Karen give necessary instruction while taking this medication, which is statement communicates understanding. Pag sinabing understanding, positive ang hahanapin natin. I must eliminate fat in my diet. Hindi po tayo nagko-completely eliminate ng fat dahil ang fat po ay importante sa katawan dahil meron po tayong tinatawag na fat soluble vitamins. Hindi po natin gusto ang 1.5 liters, mababa po yan. We do at least 2 liters. Dapat mas mataas pag nagtitake ng psychotropic drugs. I will take the usual dosage. Hindi po. Ang pag-take po ang dosage ng drugs is determined by the physician. Minsan tinataasan, minsan binababa, depende sa pangangailangan ng pasyente. Ang tama lang po dito is letter D, all alcohol-containing beverages must be avoided. Bakit po? Ang iyong alprazolam ay isang benzodiazepine na may CNS effect, katulad ng sinabi natin kanina. Nagkukos po ito ng respiratory depression. Respiratory depression ang iyong alprazolam. Ang iyong pong alcohol, ito din po ay respiratory depressant din po ito, guys. Respiratory depressant din po ito, guys. If you take alcohol together with your alprazolam, magkakaroon ka ng tinatawag na respiratory arrest. Ikakamatay po ba ito ng pasyente? Yes po, ikakamatay po ito ng pasyente. Respiratory arrest is a dangerous risk pag nag-take ng alcohol together with anxiolytic. 25, dog. 26, Kendra, 21-year-old, SSD, sorry. SSD, 1, 2, 3, go. Number 26. Kendra, a 21-year-old college student, always preferred the stairs and never took the elevator. She once tried with a friend and had an anxiety attack. Kendra is diagnosed with a specific phobia known as claustrophobic si Kendra. During interview, she shared that during her childhood, ang mother niya ay tinatago daw siya sa small cabinet pag nagkakamali siya. Pag nakikita niya ang sarili niya sa mga closed spaces, parang yun din po yung nararamdaman niya nung bata pa siya. Ano po ang ego defense mechanism na to? Maganda ang pagkakaturo at pagkaka-example dito ni Sir Kenneth. Alam na alam natin to. Displacement. Yung fear, feeling, yung mga takot, yung trauma na naramdaman mo, nadi-displace siya sa object na present ng time ng negative emotion. And whenever you are in the same situation, nararamdaman mo siya ulit, ang tawag mo doon, displacement. Number 26A. Diba ang ganda ng example dito ni Sir Kenneth? Kaya hindi mo siya makakalimutan. Number 26A. SSD na ba? For number 26. 1, 2, 3, go. Number 27, in managing the client's anxiety disorder, the therapist progressively, ito ang keyword mo, exposes the client to threatening object. Pero nasa safe setting ka, ito yung pinapakita mo muna yung picture, and then pangalawa yung actual object, and then pag tumatagal, pinapagawa mo na sa mismong pasyente, pinapahawakan mo na, progressive yung pag-expose. Hanggang nawala na yung anxiety ng pasyente, anong tawag mo dito? Systematic desensitization. Flooding is yung kabaliktaran ng systematic desensitization. Ito yung binibigla mo yung pasyente. Flooding. For progressive exposure, systematic desensitization, 27, boy. SSD, 1, 2, 3, go. 28. When assessing a client with anxiety, nag-assess ka, may anxiety ang pasyente, paano ka magtanong? Avoid until anxiety is gone, hindi ka matatapos dyan. Open-ended, hindi po. Dahil selected po ang kanilang attention. Hindi po makakasagot ng diretso yan. Postpone hanggang mag-volunteer, hindi po. Dapat specific and direct. Simple, structured question, specific, direct para makasagot ang pasyente. Number 28, dog. SSD, 1, 2, 3, go. 29. The best goal for a client learning relaxation technique is that the client will, ayaw natin i-suppress ang anxious feeling. Hindi maganda yan. Report no episodes of anxiety. Hindi po pwede na wala kang anxiety because anxiety can also be healthy for you. Katulad mo ngayon, anxious ka, 1 month na lang before ng board exam. Maganda ba yan para sa'yo? Yes po. Confront ang source ng anxiety directly or maka-experience ng anxiety without feeling overwhelmed. Gusto po natin ng B. Nakaka-experience pa din ng anxiety pero nakakapag-cope na, hindi na na-overwhelm. Number 29, boy. SSD, 1, 2, 3. 30. The nurse working with the client during a flashback says, I know you're scared, but you're in a safe place. Do you see the bed in your room? Do you feel the chair you're sitting on? Anong tawag natin dito? Anong ginagawa ni nurse? Anong ginagawa ni nurse? Grounding. Grounding po, ito yung tinutulungan mo yung pasyente na ma-remind kung nasan siya in the present in the present time and place, na siya ay safe, na may kasama siya. Ang tawag mo dyan, grounding, para hindi ma-overwhelm at mag-lead to panic attack. 30, dog, SSD, 1, 2, 3, go. 31, skilled use of Teracom. Teracom na po tayo, therapeutic communication techniques. All nurses need skills of therapeutic communication. Number 31, the nurse touches to assess skin sugar ng client na may DI. Anong tawag mo sa type of touch na ito? The nurse is functioning as a professional. This is a functional professional type of touch. Number 31A, SST 1, 2, 3, go. 32. During the orientation phase, nag-meet na ang nurse at ang pasyente for the first time at nag-introduce sila ng bawat isa, sila ay nag-handshake, ang keyword mo. Pag nag-handshake, ano pong tawag mo dyan? Social polite. Social polite. Handshaking is a social polite type of touch. 32, boy, SSD, go. 1, 2, 3, go. 33. While the nurse was having her rounds in the psychiatric ward, nakita niya at ang kliyente at ang nanay niya naghahag at sila ay nagiiyakan. Ano po ang type of touch na ito? Between a mother and a child na naghahag, ito po ay love intimacy type of touch. 33, love intimacy type of touch. SSD 1, 2, 3, go. 34. One afternoon, ang teenager was visited by his friends from school, and they hug and throw arms around each other. So this is an example of, alam mo na, friendship warmth. Friendship warmth. 35. During a nurse-client interaction, a combination of verbal and non-verbal communication must be congruent to be genuine. Which of the following is true, positive, ang hinahanap natin about Teracom? Sit next to the client at a distance not more than 3 feet, mali po. Dapat ikaw ay may distance na 3 to 6 feet. Put face closer to the client pag magdi-difficulty ang hearing, hindi po. Anong ginagawa natin dapat dito? We face the client and we try to read the lips pag hindi natin naririnig ng mabuti. Silence is a form of non-verbal Teracom that sometimes not to convey messages. Tama po ito. Develop self-awareness after first interaction, hindi po. Before first interaction, ang self-awareness. Ang tama lang po dito is letter C. Number 35, C, SSD, SSD, go. 36. During dinner, one client was not touching his food and seemed to be very quiet and sad. Ayaw niyang kumain, malungkot siya. The nurse sat next to the client. Ang sabi ng nurse, is there something you'd like to talk about? Ano po ba ito? Hindi to focusing, hindi active listening. A or B, general leads or broad opening? Broad opening, correct. Bakit po? Ang general lead, ito po yung sinasabi natin nga, okay, go on, and then, tell me about it. General lead is giving encouragement para mag-continue yung pasyente sa sinasabi niya. Pag sinabi ng nurse na, meron ka bang gustong pag-usapan, ito po yung broad opening. You allow the client to take the initiative na mag-introduce ng topic. Yun po ang broad opening. Number 36, boy. SSD, SSD, 1, 2, 3, go. 37. The client expresses frustration at work by stating, I'm so stressed at work. Every time I have to go to the office, feeling ko magkakasakit ako. Dapat na ba akong mag-resign? Sabi niya sa nurse. The nurse responded, do you think it will be better for you if you resign? Anong ginagawa ng nurse dito? Not seeking clarification, not presenting reality, restating or reflecting. Restating or reflecting. Reflecting, correct. Ang gagaling naman. Pasa na talaga. Pasang-pasa na talaga. Ang restating po, ito po yung repeating lang the main idea expressed. May sinabi yung pasyente, tapos ni-repeat lang ng nurse. Yun lang po yung restating. Pero pag reflecting, ito yung binabalik mo sa pasyente, yung thoughts niya, yung feelings niya, yung actions niya, binabalik mo sa kanya. Yun reflect mo. 37, dog, SSD, SSD, 1, 2, 3, go. 38. Nika, one of the depressed client, took a bath early in the morning. Nagdamit siya ng maganda, inayos niya yung buhok niya. Sabi ng nurse, "Uy, I noticed that you've combed your hair." Anong tawag mo dito? Hindi exploring, hindi presenting reality. A or C? Making observations or giving recognition? Okay, okay. Ang tamang sagot po is letter C, giving recognition. Pag sinabi pong making observation, ito po yung nag-verbalize ka ng na-observe mo, ng na-perceive mo. Katulad ng sinasabi mo nga, nakita mo yung pasyente, malungkutin siya, sasabihin mo, "Hi, you look sad." Ganun po yung making observation. I-verbalize mo kung ano yung na-observe mo sa patient. Pag sinabi mong giving recognition, ito po yung sabing, "Uy, I noticed you combed your hair." This encourages the client to have increased self-esteem because you are giving acknowledgement. Binibigyan mo ng recognition yung ginawa ng pasyente. Number 38, C, SSD, SSD, go. 39. The nurse noticed that the patient were having auditory hallucination. Ito po yung pinaka-serious, pinaka-dangerous na kind of hallucination. The nurse encouraged the description of perception by pinapasabi ng nurse kung ano ba. Listening to what the voices are saying. Ano yun, nakikinig ka guys? Nakikinig ka? So, pakinig nga anong sinasabi sa'yo. Tell the client to stop listening to the voices, hindi ka na makakapag-assess. Encourage the client to respond. Ano ba yan? Letter A, asking the client to directly what the voices are saying. Ito po yung sikat na what are the voices telling you, because we have to assess kung ano ang auditory hallucinations. Number 39, A, SSD, SSD, go. 40. The client was watching the news when suddenly he went running to the nurse and said, "Those people on the screen are talking about me." The nurse presents reality by stating, "Not everything about you is non-therapeutic." What do you think are they saying about you, non-therapeutic? I don't think so. They could be talking about you, non-therapeutic. Letter B, the people on the screen are news reporters. They are not talking about you. You are simply presenting reality. Number 40, boy, SSD, SSD, go. 41. 20-year-old female client is a psychiatric hospital. May schizophrenia. It's schizo na po tayo. Number 41. A nurse is assessing the client when he noticed absent ang facial expression and emotion. Anong symptom po ang tawag natin dito? Avolition is the lack of motivation and will. Anhedonia is feeling no joy. Blunt affect or flat affect? Blunt or flat? Flat. Tama po, boy. A flat affect is the absence of any facial expression that would indicate any emotion or mood. Ang iyong pong blunt, ito lang po yung restricted range of emotional feeling, tone, or mood. Magkaiba po sila. When it has to do with facial expression, ito po ay letter B, flat affect. Number 41, boy, SSD, SSD, go. La, ang galing, blunt bawas lang. 42. When does the client's diagnosis for a schizophrenic form disorder be changed to schizophrenia? So mayroon na siyang mga symptoms and presenting signs ng iyong schizophrenia. Pero ang tawag pa lang dito is schizophrenic form. Nagiging schizophrenia na siya when the symptoms persist more than 6 months. Pag more than 6 months, it's schizophrenia na siya. Number 42, dog, SSD, SSD, go. Number 43, the nurse asked the client, "How have you been sleeping lately?" The client replied, "Madami siyang sinabi." Ang dami niyang sinabi, guys. Ang dami niyang sinabi. Pero at the end of it all, nakasagot naman siya. "I have been getting only 2 to 3 hours of sleep at night." Nakasagot. Anong tawag mo dito? Hindi looseness, hindi flexibility. Tangent or circum? Tangent or circum? Very good. Circum po, bumalik. Nakabalik, circum. Pag hindi nakabalik, ano? Tangent. Pag hindi nakabalik, tangent. Pag nakabalik, circum. Circle, tama. Number 33, circum, boy. SSD, SSD, go. 44. Imbalances of neurotransmitter in the brain is believed to be one of the causes ng development ng schizo. What are the imbalances na seen to occur in the brain for a patient diagnosed with schizo? Ano po ang imbalances na meron sa schizo? Ang iyon pong letter D, increased zero anopy is bipolar po ito. Decreased ang serotonin and norepinephrine. Ito po yung pinag-usapan natin kanina na MDD, Major Depressive Disorder. Pag-decrease ang dopamine, ano po ito? Pag-decrease ang dopamine, Parkinson's. Ang iyon pong schizo is increase ang serotonin at dopamine. Increase serotonin and dopamine sa iyong schizo. 44A, SSD, go. 45. These imbalances in the client's brain causes both positive and negative signs. Alam na po ba ang pinagkaiba ng positive and negative signs? Ang positive po, ito yung mga hallucination, delusion, illusion. Yun po yung mga positive. Yung negative naman po, ito yung mga avolition, yung mga lack of motivation. So, ang tinatanong sa iyo dito, ano ang considered na negative sign? Positive to, positive to, positive to. Avolition po ang negative. 45, dog. Absence or lack of motivation. 45, dog. SSD. 1, 2, 3, go. 46. Catatonia is often seen in patients with schizophrenia. Nursing diagnosis is impaired ang motor behavior mo sa iyong catatonic patient. What is the nursing intervention related to the diagnosis? Catatonia po is a motor disorder kung saan ang pasyente ay nagmi-maintain ng abnormal and weird body position. Hindi siya gumagalaw. Nakaganon lang siya. Hindi ka makakasulit ng activities. Hindi helpful ang complete bed rest. Passive or active? Hindi nga po gumagalaw, so hindi po siya makakapag-active ROM. You do passive ROM exercises to promote good blood circulation sa pasyente. Number 46, boy, passive ROM, SSD, go. Number 47, the client lack hygiene due to episodes of psychosis. Ito ang keyword mo, psychosis. What is the best way to teach the client about hygiene? Magdedemo ka kung paano maligo o hindi. You let the client decide, hindi maliligo yan, guys. I-assist mo yung client sa pagligo, hindi po. This will not promote autonomy. Ang sagot po dito, pag psychotic ang pasyente, A. The nurse direct the client in a short and clear statement. This promotes autonomy. Number 47, Apple, SSD, go. Number 48. The client reports to the nurse na may she feels her legs are moving. Sabi niya parang gumagalaw yung mga paa ko, pero motionless naman. Hallucination is a false sensory perception. What type of hallucination does the client experience? Anong hallucination to? Pag sinabi mong synesthetic, ito yung nararamdaman mo yung mga bodily function na hindi mo naman usually dapat maramdaman. Katulad ng sinasabi mo nga, nararamdaman ko na dumadalo yung dugo ko. Nararamdaman ko na nagfo-form yung ihi ko. Ganyan po yung synesthetic hallucination. Visual, alam natin yan. Tactile, ito po yung parang sinasabi ng parang may gumagapang na mga insekto sa skin ko. Yan po yung tactile. Number 40 is letter C. Kinesthetic hallucination is when emotionless naman yung patient pero sabi niya gumagalaw siya, lumilipad siya, lumulutang siya. Kinesthetic hallucination. Number 48, C, SSD, go. 49. The client read an article in a newspaper about a missing actress. Tapos sabi niya, siya yung nasa headline. Siya daw yung nasa headline. Anong delusion yan? Grandiose. Number 49, grandiose. 50. SSD na ba? Go. 50. The client tells the nurse that Eschurg is about to eat her alive. What unusual speech pattern, ano to? Meron siyang ginagawang mga bagong words na non-insisting, new but not insisting, neologism. Word salad, ito po yung flowery words. Ecolalia, ito yung parrot-like. I know. Stilted language, ito yung flowery. Word salad, ito yung halo-halo yung sinasabi ng pasyente. Ecolalia, ito yung parrot-like. Formation of new words, neologism 50, SSD, go. Number 51. The physician prescribed a typical second-generation antipsychotic for the patient. Which of the following medications belong to this generation? So, sinulat na po natin dito para hindi na tayo mahirapan, no? Ang iyong first gen, ang typical medications, nag-i-in sila ng zines. Maliban lang sa haloperidol, ang haloperidol mo, first gen po yan, pero hindi siya nag-i-in ng zine. Thorazine, flofenazine, zinzine, first gen. Aripiprazole, zol, third gen. Ang tinatanong sa'yo, second generation. Clozapine and olanzapine and sweetpine, second generation. 51 dog. SSD, 1, 2, 3, go. 52. The patient started taking clozapine, nag-take ng clozapine. Which of the following is a positive sign of improvement? Para ano po ba ang clozapine? Clozapine is a second generation antipsychotic na nagmamanage po, ang minamanage niya po ay negative symptoms. Dahil alam mo kung anong negative symptoms, lack of motivation, malungkutin ang pasyente, yun po yung negative symptoms. Pag minanage niya yon, meaning mag-i-improve yung pasyente, magiging masigla, magiging masayahin, magiging malakas. So ano ang sign of improvement? Participation in activities. Participation in activities. Hallucination is positive po. Mga positive symptoms po ito. Sign of improvement, participation of activities dahil nawala ang negative symptoms. 52, dog, SSD, go. 53. For a client who is non-compliant to the medication regimen, non-compliant sa medication regimen, the nurse expect the physician to prescribe. Anong word ang hinahanap natin? Pag non-compliant at kailangan natin lang long-term medication, anong term? Decanuate. Number 53, boy, flofenazine decanuate. Ito po yung nagbibigay tayo ng IM injection either once or twice a month. DPAT injection given IM once or twice a month na may long-term effect. 53, boy, SSD, go. 54. The client is taking an antipsychotic medication. Naka-experience siya ng lightheadedness whenever she tries to rise. Anong tawag mo dito? Orthostatic hypotension. Ang tawag mo dyan. What is the best nursing intervention pag nagkakaroon ng orthostatic hypotension? Huwag kang mag-anti-vertigo agad. Hindi mo kailangan ng trapeze. Stay still and do not move is not the solution. Rise slowly from sitting or lying position. Progressive slow change of position prevents orthostatic hypotension. Number 54A. Ay, hindi ko po alam kung bakit mali. Paki-check na lang po. Kung tama kayo, pa-check na lang po sa sarili. Number 54A. Palagi din ganun sa amin. 54A, SSD, 1, 2, 3, go. 55. The client reported difficulty in defecation. Constipated na. She started her medication. What nursing instruction must the nurse give to the client? Independent po ang dependent ang laxative, hindi mo priorito, hindi ka mag-i-stop, hindi mo kailangan mag-report ka agad sa doktor. Ang kailangan mo lang, increase fiber intake to increase fecal volume. Hindi na mahihirapan tumahi ang pasyente pag increase ang fecal volume, pag increase ang fiber intake. Number 55C. SSD, 1, 2, 3, go. 56. EPS, ang ating pag-uusapan, extrapyramidal syndrome, is an unwanted side effect commonly seen in patients taking first-gen antipsychotics. Early detection may prevent EPS in the patient. The nurse should watch out for the following except. Ang iyo pong EPS, ano ang coding mo sa EPS? EPS is equal to DAP. DAP. Ano to? Dystonia. Ano to? Akatisha. Ano to? Pseudo-Parkinsonism. Pseudo-Parkinsonism. Dystonia, akatisha, pseudo-Parkinsonism. Ito po ang mayroon sa iyong extrapyramidal syndrome. Abnormal muscle contraction is your dystonia. Restlessness and inability to stay still is your akatisha. Fine tremors and stable gait is your pseudo-Parkinsonism. Ang exception natin ay nahanap na negative muscle rigidity. Saan mo nakikita ang muscle rigidity? Sa NMS, sa Neuroleptic Malignant Syndrome. 56, jog. SSD, go. 57. The patient started to manifest signs of EPS. Nagpapakita na siya ng DAP, yung signs ng EPS mo. Ano ang initial nursing action mo? Withhold, discontinue, notify. Hindi ka mag-instruct na mag-continue ang pasyente dahil nagkakaroon na nga po ng EPS. Pakak ang gagaling. Notify, hindi ka mag-withhold, hindi ka mag-discontinue dahil magkakaroon ng withdrawal symptoms. Ayaw mo yan, delikado yan. So ang gagawin mo sa pag-EPS pa lang, dahil pag NMS, ibang usapan na yon. Pero pag EPS pa lang, nagno-notify ka ng patient, ng physician dahil ang physician, pwede po siyang mag-adjust ng dose. It's either i-adjust yung dose, i-shift yung medication, or same drug class pero ibang medication na or mag-shift sa ibang drug class ng antipsychotic. You notify the physician first. Again, pag EPS ang pinag-uusapan dahil ibang usapan pag NMS. Number 57, jog. SSD, go. 58. Signs of pseudo-Parkinsonism has been seen on the patient. Nagkakaroon na siya ng pseudo-Parkinsonism. What is your drug of choice to contradict manifestation? Palagi pong lumalabas to, sikat na sikat to, si amantadine. 58. Si amantadine po ay sikat na sikat. Siya po ang iyong drug of choice for pseudo-Parkinsonism. Ito po ay first line of treatment for pseudo-Parkinsonism. Propranolol is for akatisha. Benadryl and cogentine is for dystonia. Ito po ang for pseudo-Parkinsonism. Number 58, boy, SSD, go. 59, Neuroleptic Malignant Syndrome. Ito na po yung sinasabi ko kaninang NMS. Is a group of symptoms and is most fatal side effect ng antipsychotic. Ito po ang most fatal side effect ng antipsychotic. Bakit po? Anong nangyayari sa iyong NMS? Ang meron po sa iyong NMS is NMS. Tatlo din po. High fever, hypertension, and muscle rigidity. Ang iyong high fever at hypertension, pwede po itong mag-lead to seizure. Ang iyo naman po ang muscle rigidity, pwede po itong mag-cause ng laryngeal spasm, which can lead to airway obstruction. Fatal po ba ang mga ito? Nag-seizure, nag-airway obstruction, fatal po ba? Yes, can cause death. Ano ang initial nursing intervention? What nursing intervention is vital in preventing this from occurring? Paano mo po ma-prevent ang NMS? Ang iyong pong antipsychotic drugs, magra-rush na po ba ako? Alam niyo na. Ang iyong pong antipsychotic drug ay may anticholinergic effect. So, pag may anticholinergic, dryness. Pag may dryness, may dehydration. Pag may dehydration, nagko-contribute sa muscle spasm and fever at pwedeng mag-cause ng airway obstruction. Yes, ang galing. Kailangan niyo pa ba ako, guys? So, ang ating prevention is increase oral fluid intake. Increase oral intake. Number 59A, SSD, go. 60. 18 weeks after the client started taking her antipsychotic, she develops high fever and muscle rigidity. So ayun na, symptoms na to ng NMS. Alam mo na kung anong gagawin mo dito. What should the nurse do when her client reports this symptom? Stop, stop, stop. Dahil nakakamatay. Ang EPS, report to the physician, pero pag NMS, stop, stop the medication. 60C, SSD, 1, 2, 3, go. 61. An 18-year-old female client in a psychiatric hospital is diagnosed with bulimia nervosa. Bulimia nervosa na po tayo, eating disorders. The following are true about bulimia nervosa except negative ang hinahanap. Ito po ay characterized by recurrent episodes of binging and eating, positive to. Purging, fasting, excessive exercising, positive din to. Amount of food consumed during binging is much larger than a person would normally eat, tama din to. Ang mali po natin dito is letter dog, hindi po sila severely malnourished. Ang severely malnourished po is yung ating anorexic patient. Dahil kumakain pa din po ang mga bulimic, sila po ay nakaka-maintain ng normal body weight. Number 61, dog. SSD, go. 62. The client was referred to a psychiatric health unit, which healthcare professionals often to be the first to identify clients with bulimia. Dentist, dahil po pagsuka ng suka, ang hydrochloric acid dumadaan sa bibig, nasisira po ba ang mga tooth enamel? Yes po, nasisira ang mga tooth enamel at nagkakaroon ng problema sa ngipin. Ang unang nakaka-identify noon ay dentist. Number 62, dog. SSD, go. Number 63. Self-monitoring is a cognitive behavioral technique designed to help clients with bulimia. Self-monitoring. It helps clients identify behavior pattern from technique to avoid and replace them. Ano ang example ng self-monitoring? How do you encourage self-monitoring? Hindi ka mag-encourage na bilangin niya yung caloric intake niya ha, ginagawa niya na yan. Monitor the client is not self-monitoring, it is the nurse monitoring. Correct answer, letter C. Let the client write about all feelings and experience related to food. Ito po yung tinatawag nating journaling and diary writing. Journaling and diary writing. Number 63, C, SSD, go. 64. The client with bulimia was done eating. Tapos na siyang kumain. To monitor if the client has not purged, ano ang best nursing action mo? Ito. Observe the client following meals and snack 1 to 2 hours post-meal. Bakit po? 1 to 2 hours post-meal, in-stimulate niya yung gag reflex niya para siya sumuka. Papasukahin niya ang sarili niya 1 to 2 hours post-meal. 64B. SSD, go. 65. The nurse is evaluating the progress of a client with bulimia. Which behavior would indicate that the client is making positive progress? Paano mo masasabi na nagpa-positive progress ang iyong bulimic patient? Nakaka-identify ng sure, alam niyo na to. Ay, hindi to, guys. The client verbalizes knowledge of former eating patterns as unhealthy. The client is with them resting in her room after meals. The client in healthy ways of coping anxiety is the correct answer. Bakit po? Ano ang root cause ng iyong bulimia nervosa? Anxiety. The root cause of bulimia is anxiety, and yung bulimic behavior niya is the unhealthy way of coping anxiety. So masasabi mong nagkakaroon na siya ng positive progress kung mayroon na siyang healthy ways of coping with anxiety, hindi na yung bulimic behavior niya. Number 65, boy. SSD, go. 66, situation. Si Loisa, 17 years old, inpatient eating disorder, ang diagnosis niya, anorexia nervosa. Tapos na tayo sa bulimia, anorexia na po. The client is being evaluated upon admission. Which assessment finding will suggest anorexia nervosa? Meron ba siyang guilt and shame about eating patterns? Wala po, proud na proud yan si ate girl. Proud na proud yan. Lack of knowledge, hindi po. Knowledgeable po siya. Sobrang knowledgeable yan. Refusal to talk about food, hindi po. Ang mukhang bibig niyan, food topics, diet. Ang sagot po is letter D. Unrealistic ang perception ng body size niya. Pag titingin niyo sa salamin, ang nakikita niya, mataba siya. Kahit ang totoo, severely malnourished na siya. Number 66, dog. SSD, go. 67, which is not a priority goal for treating a severely malnourished client with anorexia. Priority mo, physiologic over psychologic. Tanggalin mo yung psychologic. Correction of body image. Itong tatlo is vertigo, which is not pala. Which is not a priority goal. So priority mo to dahil physiologic sila. Ang hindi mo priority, psychologic, sagot, letter A, correction of body image. 67A, SSD, go. 68. The physician orders evaluation of client's weight to monitor progress. The nurse correctly monitors the client's weight by weighing the client. Ilang beses ka bang nagtitimbang sa isang araw? Daily weight, once lang po, isang beses lang. Tanggalin mo na yung dalawang twice. Magpipili ka na lang kung before emptying or after emptying the bladder. Tama po, after emptying the bladder to give you accurate weight of the client. Paihiin muna, din timbangin mo. Number 68, jog. SSD, go. 69. What technique can be used by the nurse to a client who binge and purge? Nagbi-binge and purge ang pasyente mo, gusto mo siyang i-distract. Pwedeng DIY craft, pwedeng music therapy, pwedeng oil painting. Ang umbrella answer mo, apple. Distraction, apple. Dahil ito pong tatlo ay under distraction. Ito po ay umbrella term. 69, apple. SSD, go. 70. Treating clients with anorexia nervosa with selective serotonin reuptake inhibitor or SSRI, antidepressants such as fluoxetine Prozac may present which problem? Bakit po tayo nagbibigay ng SSRI? Antidepressant po to. Ito yung disorder naman ang problema natin. Bakit tayo nagbibigay ng SSRI sa anorexic patient? Bakit? Underlying depression. Kung sa iyon pong bulimia nervosa, mayroon kang kung sa iyong bulimia nervosa, mayroon kang anxiety as your root cause. Sa iyon pong anorexia nervosa, mayroon ka pong underlying depression. Kaya po ang ating drug of choice to relieve yung symptoms ng ating anorexia nervosa is nagbibigay po tayo ng selective serotonin reuptake inhibitor which is an antidepressant. So para po give ng solution yung underlying cause ng anorexia nervosa, nagbibigay ka po ng SSRI. Kaso, nagkakaroon po tayo, it presents with a problem dahil ang iyong pong fluoxetine ay nagkukos ng appetite suppression at weight loss. Ang iyong pong anorexia nervosa is already severely malnourished. Hindi na kumakain yan. But nevertheless, we still give SSRI dahil ito po ay drug of choice sa kanyang underlying cause na depression. Nagkakaproblema lang tayo na instead of addressing the physiologic problem which is weight loss and malnourishment ng patient, nagkukos pa po ito ng further weight loss and appetite suppression. Yun po ang problem sa fluoxetine. Number 70, boy. 123, SSD, go. 71. A female client is diagnosed with MDD. Ang pag-uusapan po natin dito is antidepressants. A client is taking SSRI. How many days is expected for the patient's energy to return? Normally po, ang sinasabi natin, bantayan ang pasyente nagtitik ng antidepressant 2 weeks dahil din po bumabalik yung sigla nila dahil most antidepressants po talaga is lumalabos na po ang kanilang therapeutic effect 2 weeks after. Pero dahil po very good ang iyong SSRI at ito po ang fastest antidepressant, nare-relieve na po siya ng symptoms in a matter of 4 to 7 days. 4 to 7 days. Nagre-relieve na po ang SSRI ng symptoms in a matter of 4 to 7 days. Number 71, Jog. SSD, SSD, go. 72, a patient is taking Zoloft for her depression. Nag-complain siya ng dry mouth and throat. What is your simple nursing intervention to address the problem of the client? Lower dosage, no. Report, no need. Stop the medication, no. Increase fluid intake. Ipapasa ka ng increase oral fluid intake, tama ba? Ipapasa ka ba ng increase oral fluid intake? Yes po. Address dryness by increasing oral fluid intake. 72, boy. 73, stay hydrated mga B. A patient complains of confusion while taking Pamilor. What is the nursing intervention for this patient? Ang iyong pong confusion, pag nagtitake ka ng Pamilor, ito po ay sign of overdose. As a nurse kasi, sa board exam, parang in-expect sa'yo na alam mo yung mga sign of overdose, ano yung side effects, ano yung adverse effect, ano yung sign of underdosage. So, nung binigyan ka sa situation na sinabi na nag-experience ang patient ng confusion while taking Pamilor, you're expected na alam mo na sign ito ng overdose. Ang tanong, ano ang nursing intervention mo sa pasyente? Report to the physician. Hindi ka mag-administer under vertigo, this will not help, this will not help. As a nurse, alam mo dapat na sign to ng overdose. Nung sinabi ng pasyente na confused siya, it is an objective data na parang part of assessment. Ang susunod mong gagawin, magre-report ka na sa physician. Dahil ito po ay sign ng overdose para ma-adjust po ang dosage. Number 73A, report to the physician. Number 74, a female client diagnosed with depression have been found to be pregnant. Buntes, what is the best treatment for her? Depressed siya. Anong sagot? Pare-parehas po silang antidepressants. Pare-parehas pong antidepressants ang SSRI, MAWI, and TCA. Hindi po tayo nagbibigay ng medications na antidepressants because they tend to be teratogenic. According kay Tita Sheila Vidibek, ang ECT po ang safest way to relieve depression sa pregnant client. Pregnant woman can safely have ECT while many medications are not safe for use during pregnancy. So ang treatment of choice natin is electroconvulsive therapy for pregnant depressed clients. Number 74, DOG. SSD, go. Number 75. A patient tells the nurse that she got 75 grades subject in school. This could mean failing the whole course, then hindi daw siya makakagraduate, hindi siya makakatrabaho, magiging mahirap siya, magiging homeless siya, then eventually mamamatay siya. Anong cognitive distortion ang tawag mo dito? What cognitive distortion do you call this? Letter B, minimization and magnification. And it's specifically for the situation, magnification po yan. Ito yung ino-overestimate mo, yung simple event, overvaluing the simple event, tapos iniisip mo na end of the world na. Magnification. Number 75, POI, SSD, go. 76, the nurse is conversing with the patient and the patient took 30 seconds to respond to the question. Nagtagal. Anong tawag mo dyan? Late ang response. What symptom that the patient shows? Latency of response. Latency of response. Late ang response. Number 76, C. SSD, go. Loading na friend. Loading na ako. Naglalag? Goods ba tayo? Di po. Ano bakit po sinabing loading na? Goods. Yung choices. Okay. Wala, hindi ko siya na-gets. Hindi ko siya na-gets. Loading. May latency of response din po ako. Ganun. Ay, sorry na. Number 77. 77. A patient expresses to the nurse, I don't feel like myself. I don't know what to do. Sabi niya. What is the best response by the nurse? What is the best response by the nurse pag sinabi to? Ayaw natin ng why questions. Why questions and no, 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 no. That's dahil it will demand explanation from the patient and ito po ay stressful. When did you feel like that? B or C? That must be frightening. Sit with the client silently. Uy, madami talagang nagagamali dito. Ang sagot palagi, sit with the client silently. Ang tamang sagot po is letter B. That must be frightening. Ano po ang tawag dito? Validating, guys. Nag-express ang client ng kanyang nararamdaman sa'yo. I-validate mo siya by stating that must be frightening. If you validate, it is important for the client to see na nakikinig ka. Okay din naman po yung sit with the client silently kasi therapeutic din naman po ang silence. But in this case, kung saan nag-express ang client na kanyang nararamdaman, it is good to validate. That must be frightening. Number 77, boy. SSD, go. Number 78, a patient tells the nurse that her friend was in a car accident and believed that the accident was related to her. Sabi niya, kasalanan ko yun. What cognitive distortion is this? Personalization. Personalization, ito po yung tendency to self-reference external events na wala ka namang basis. Sinasabi mo tungkol sa'yo, dahil sa'yo, para sa'yo, kahit hindi naman. Ang tawag mo dyan, personalization. 78, dog. SSD, go. 79. The patient complains of not being able to sleep after taking her Maui antidepressant. Ano ang intervention mo? Hindi makatulog. Hindi makatulog. Kailan mo ibibigay? Ibibigay mo sa umaga. Tapering is not your job. You don't have to report to the physician. Hindi, wag kang magbigay ng sleeping pills. Ibigay mo lang sa umaga. Nursing intervention. Number 79, boy. SSD, number 80. Napag-usapan na natin to kanina. Ano daw yung neurotransmitter na decrease pag may depression? Ano nga ulit yon? Nori and stero. Nori and stero together with dopamine, pero mostly norepinephrine and serotonin decreased in depression. 80, Apple, SSD, go. 81, situation. Si Rachel, yung executive at her own company, meron siyang bipolar 1. She is on lithium therapy, pero recently daw, it was discovered na hindi na siya umiinom. Discovered missed dose of her lithium. So, nagkaroon siya ng manic episode. And isinugod siya sa emergency psychiatric unit. Ang tanong sa number 81, ano ang characteristic ng bipolar 1 mo? Mild mood swings between hypomania and depression. Anong tawag mo dito? Anong tawag mo dito? Cyclothymia. Cyclothymia. C. Cycles alternate between periods of mania, normal mood, and depression. Ito po ang tinatawag nating bipolar mixed. Bipolar mixed. Recurrent depressive episodes with at least one hypomanic, bipolar 2 lang po ito. Pag hypomanic lang ang episode, hindi manic ang episode, hypomanic lang, bipolar 2 po yan. Pero pag manic ang episode tapos may isa kang depressive episode talaga, hindi lang hypodepression, yan po ang bipolar 1. Kung makikita mo, 'di ba normal to? Normal. Wait, dito na lang. Depression, hypodepression, normal, hypomanic, manic. Ang range po ng iyong bipolar 1 is mayroon kang depressive episode at mayroon kang manic episode. Ganito po ang range niya. Meron siyang depressive episode, meron po siyang manic episode. Ang pinagkaiba po ng bipolar 2, ang bipolar 2 mo po is hypomanic lang. Wala siyang manic episode. Yan po ang pinagkaiba ng bipolar 1 at bipolar 2. Meron pong depressive episode ang iyong bipolar 2, pero hypomanic lang siya, hindi siya manic. Yan ang pinagkaiba niya sa iyong bipolar 1. Number 81A. SSD, go. Number 82. The nurse observes that Rachel is pacing in the hall, talking loudly, rapidly, and using elaborate hand gestures. I am gonna turn off my kuan because ang daming notification. The nurse concludes that the client is demonstrating hindi to aggression, hindi to si Sir Alvis po ba nagturo niyan? Yes po, meron po. Yes po, si Sir Alvis po. Yan po ang ginamit ko para ma-memorize. Dinikit ko lang po siya sa dingding, na-memorize ko na po silang lahat, napakadali pong sagutan. Hindi po to anger, hindi po to anxiety. Ang tawag po natin dyan is psychomotor agitation. Psychomotor agitation. Number 82, dog. SSD, go. 83. The client could stop pacing around talking, nagra-rhyming siya. Rich Mitch, King Rich Mitch. Ano ang tawag mo sa speech pattern na may rhyming? Rhyming. Pag ekulalya, parrot-like. Pag stated language, flowery. Verberation or clang? Tama po, clang. Pag rhyming, clang. Ang verberation, ito po yung sinasabi niyang go home. Yung nire-repeat niya po yung mga last syllables ng kanyang sinasabi na wala namang meaning sa nakikinig. Pag rhyming, ito po ay clang associations. Number 83C. Number 83C, SSD, go. 84. What defense mechanism is involved in patient manifesting manic behavior? Defense mechanism, ano pong meron sa iyong manic patient? Ang manic behavior po, ito po ay manifestation ng underlying depression. Ang mga manic patient mo po is depressed talaga sila. Pero they are trying to mask the depression by showing a manic behavior. Ano pong tawag natin doon? Pag opposite ang ipinapakita doon sa totoong nararamdaman. May underlying depression pero ang minapanifest mania, ang tawag po natin doon reaction formation. Opposite sa totoong nararamdaman ang pinapakita. Ito po ang defense mechanism ng iyong manic patient. 84, boy, SSD, go. 85. Nurse Rachel invading the personal space of one of the other clients. The nurse may redirect Rachel's attention by stating, ang iyong pong manic patient is madami po siyang energy. Palagi po siyang nadumidisturbo at nakikipaglokhan sa ibang mga pasyente. Paano mo siya i-redirect? Is the bothering other people? Hindi makikinig yan. Behave appropriately? No. To show better things to do? Non-therapeutic? Sabihin mo, I'd appreciate if you help sitting up circle chairs in the group therapy room. Anong ginagawa mo dito? Dinidistract mo siya by giving the patient large motor activity. By this way, nakukonsume po yung napakataas na energy ng iyong manic patient at the same time, nagkakaroon po siya ng activity that is socially acceptable and productive. Number 85A. SSD, go. 86. Clients with mania may get little rest or sleep even if they are on the brink of physical exhaustion. Kahit na pagod sila, hindi pa din sila nakakatulog. The following are nursing interventions that help promote sleep to the client, except negative. Quiet environment, tama po. Consistent ang bedtime, tama po. Provide tepid bath dahil comforting po ito sa pasyente, tama po. Ang hindi po dito nursing intervention, medication, ito po ay dependent nursing intervention, hindi mo yan priority. Priority mo ang independent nursing intervention. Number 86C. SSD, 1 to 3, Okay, number 87. The physician prescribed for Rachel to continue her lithium therapy with strict adherence. Ano daw po, identify the serum lithium level for maintenance and safety. Ang ating usual na ginagamit na value ng serum lithium is 0.6 to 1.2. Pero meron din pong gumagamit talaga ng 0.5 to 1.5. Pero kung ang gamitin mo is 0.6 to 1.2, ang pinakamalapit pa rin po dyan na therapeutic level is 0.5 to 1.5. Number 87, boy. SSD, go. 88. What is the rationale for a person taking lithium to have enough water and salt in his or her diet? Bakit po dapat may enough salt and water sa diet? Dahil po ang iyong lithium ay salt. Parehas po ng sodium, ang lithium mo po ay salt din. So ang nangyayari dahil may greater affinity siya sa receptor sites, imbis na sodium ang mag-bind sa mga receptor sites niya, ang lithium ang mag-bind. Pag mag-bind ang lithium mo sa mga receptor sites, ano ang magiging result? Lithium toxicity. Dahil hindi po siya lalabas sa katawan, mag-i-increase po ang kanyang concentration, leading to lithium toxicity. Pag mababa ang sodium intake mo. So it is important to instruct the client to have enough water and salt in his diet para hindi mag-bind ang lithium sa receptor site ng sodium at hindi mag-lead to lithium toxicity. Number 88, dog. Gets po ba ang part na yon? 88 dog, SSD, go. 89. After 3 days into therapy, the client says, my hands are shaking, which is the best response by the nurse. Fine motor tremors are Fine motor tremors are early and effective lithium therapy just for signs in a week. Ito po ang tamang sagot. You should inform the client na magkakaroon siya ng fine motor tremors na as an early effect ng lithium therapy para hindi siya maging cause of concern. At nawawala po ito after a few weeks. Huwag mong invalidate by saying it is nothing to worry about. Hindi po siya sign of toxicity. And napaka non-therapeutic po ng iyong letter D. Correct answer is number 89A, apple. SST, go. Number 90. Uy, mabilis. A client in an acute stage of mania may exhibit signs of psychosis. May mania siya, pero nag-i-exhibit siya ng signs of psychosis. Break. Uy, grabe naman, last 10 items, break. Tapusin na lang po natin. Kasi after nyo, may class pa po ako. Yeah. Okay. Ang question po natin dito, ang pasyente is nasa acute stage ng mania niya, meron po siyang nag-i-exhibit po siya ng signs ng psychosis. Ang psychosis mo, delusion, hallucination, illusion. What pharmacologic therapy ang expected mo na ibigay sa pasyente? Hindi anxiolytic, hindi antipsychotics or anti-manic. May mania, may psychosis. Anong ibibigay? Antipsychotics or anti-manic? Correct. Ang answer yung lahat, antipsychotic. Dahil ang i-relieve po natin dito is hindi naman yung mania, ang i-relieve po natin dito is yung signs of psychosis na ini-exhibit ng pasyente. So ang ibibigay mo po dito is antipsychotic. Madalas pong lumabas yung ganito. Sa board exam po namin may ganito talaga. Yung patient is ganun din, meron siyang ibang sakit pero nag-i-exhibit siya ng signs of psychosis. So yung choices namin doon is hindi anti-manic, antipsychotic, talagang specific na medication. Specific medications na anti-manic, specific medication na antipsychotics, ganon. Hindi lang yung bastang drug class. Kaya dapat alam mo kung ano yung medications under the drug class. Kasi yung lumabas po sa board exam is specific na medications talaga. 90, boy. 91. Christian, a 14-year-old boy is about to perform his first piano recital, attending piano lessons for 6 weeks. Pero, bigla siyang nagkaroon ng pain involving his hands. He was diagnosed ng tinatawag na conversion disorder. Which of the following is true, positive, about conversion disorder? They may interpret neurobiology as sign of disease. Ito po ay about sa illness, anxiety, hindi po to. They often exaggerate and fabricate. Hindi po. Totoo po ang symptoms. Symptoms are real. Hindi po sila nag-exaggerate. Hindi po all of the above. Letter C ang sagot. Anxiety is converted to a neurologic manifestation in absence of organic cause. So yung anxiety po, nako-convert po siya into physical symptom, pero wala pong organic and bodily cause. Yun po ang conversion disorder. 91C. 92. The nurse is caring for Christian will expect which of the following during assessment. Si Christian po ay may conversion disorder. Ano po ang ini-expect natin sa may patient na may conversion disorder? Label. Indifference. Indifference. Ito po yung ini-ignore nila yung manifestation ng kanilang sakit. Ito po yung unconcerned sila sa presenting symptom ng kanilang conversion disorder. Indifference about physical symptom. Ano po yung labile mode? Yung labile mode, ito po yung rapidly changing yung mood. Pampalito lang po ito sa tinatawag na labile indifference. Number 92, boy. SSD, go. 93. Due to the occurrence of pain, Christian was excused from recital. This gain is called, pero po tayong dalawang gain, yung primary gain and yung secondary gain. Pag na-relieve ang symptoms at hindi nakapag-recital, ano po ito? Primary or secondary? This is the primary gain. Dahil na-relieve po ang anxiety. Ang primary gain po is na-relieve ang anxiety. Ang secondary gain naman po is nakagain ka ng attention. Yes. Secondary is nakagain ka ng attention mo lang sa mga tao, sa mga loved ones mo dahil nagkasakit ka. Na-relieve, na-excuse siya sa piano recital, na-relieve ang anxiety, ito po ay primary gain. 93, Apple, SSD, go. 94. What is the appropriate nursing diagnosis for a patient with conversion disorder? Appropriate nursing diagnosis? Sagot, ineffective denial. Hindi stress overload, hindi impaired resilience. Between ineffective coping and effective denial po ang sagot. Ineffective denial is a nursing diagnosis na wherein ang pasyente consciously or unconsciously they attempt to deny knowledge or meaning ng isang event simply to reduce ng anxiety. Ito po ay delikado dahil it can lead to detriment of health. Kasi may nararamdaman na siya, masama na ang nangyayari sa kanya, pero nagdi-deny pa din siya. Ang tawag po dyan ineffective denial. Number 94, boy. Number 95. Few months later, Christian's parents brought him back to the clinic and had the same complaints. So si Christian, bumalik na naman siya, ganun pa din po ang complaint niya. Anong gagawin mo? I-refer mo ba kaagad? Hindi po. Ito or ito. Hindi ka mag-ignore ng complaint. Magpo-perform ng physical assessment or encourage client to verbalize feelings. Pag ito ang gawin mo, nag-assume ka na. Nag-assume ka na ganun pa din ang nararamdaman ng pasyente dahil pa din sa conversion disorder. Pwede namang hindi na. Pwede namang hindi na. Kaya ang unang mong gagawin is mag-nursing process ka, assessment. I-assess mo muna ang pasyente. Dahil baka this time may organic cause na. Number 95, dog, SSD, go. Situation. Substance abuse, last situation po. Substance use and dependence include major impairment in the user's social and occupational functioning, behavioral, and psychological changes. Number 96, a 24-year-old client was brought suspected with stimulant abuse. Pag sinabi po nating stimulant, ano po ito? SNS. Stimulant. Ang effect po nito ay SNS effect. Pag SNS, taas ang BP, taas ang HR, taas ang RR, and pupil dilatation. Hypertension, tachycardia, respiration, lahat po ito ay SNS effect. Ang tanong sa iyo, except the following are signs of abuse the nurse expect pag ang client may stimulant abuse, pupil constriction. Dahil ang meron po sa stimulant is pupil dilation. Pupil dilation. Saan po nangyayari ang pupil constriction? Sa inyo pong narcotics or downers. Downers. narcotics or downers. Number 96, A. SSD, go. 97. Opioid withdrawal develops when drug intake ceases or decreases markedly. Nagkakaroon pa ng opioid withdrawal. So medication-assisted therapy is done to avoid severe withdrawal symptoms. Ano ang drug of choice mo for detoxification? So pag nag-opioid withdrawal ka po, hindi po basta-bastang tatanggalin mo na lang agad yung opioid dahil delikado po ang withdrawal symptoms nito. So ang ginagawa po, nagbibigay tayo ng opioid din, pero ito po ay low potent opioid. Binibigyan ng low potent opioid and then tinitaper down. Ito po ang pagde-detoxify. Ano po ang drug of choice for detoxification? Methadone. Ang methadone po ay low potent opioid used for detoxification. 97C. SSD, go. Okay. Number 98, a client comes to day treatment alcohol intoxicated. Pero sabi niya, hindi siya lasing. The nurse identifies that the client is exhibiting symptoms of ano po ang defense mechanism ng mga alcoholics. Defense mechanism mo to, guys. Defense mechanism mo to. Ha? Denial. Ito po ang defense mechanism ng mga alcoholics. Number 98A, denial. 99. Disulfiram antabuse is used in managing patients with alcohol abuse to maintain sobriety. Ito po yung sinasabi natin kahapon na aversion therapy na disulfiram-like effect pag ang pasyente na naka-metronidazole flagyl tapos nag-take ng alcohol, nagkakaroon siya ng disulfiram-like effect. Ano pong nangyayari? When taking disulfiram with alcohol, nagproduce ito ng unpleasant effect, headache, palpitation, mental disorientation, and nandiyan na rin po yung nausea and vomiting. Ang tawag po natin dito is aversion therapy. Ang aversion therapy is defined as your punishing a behavior with unpleasant stimulus. Pag ang pasyente na nagtitik ng disulfiram, umilim ng alcohol, napapanish siya with unpleasant stimulus. Ang tawag, aversion therapy. 99 boy, SSD, go. Number 100, a client on stage 2 of alcohol withdrawal is being managed with clonidine catapres. Clonidine catapres, which nursing assessment is essential before giving a dose of this medication. Sa stage 2 po ng iyong alcohol withdrawal, isa pong symptom nito, sign is hypertension. Sa stage 2 ng alcohol withdrawal, kaya po nagbibigay tayo ng clonidine catapres. Ano po ba ang clonidine catapres? Ang clonidine catapres po is a central acting anti-hypertension. Kaya before ka magbigay ng clonidine catapres sa stage 2 patient with alcohol withdrawal, ang i-assess mo ay blood pressure ng pasyente. Okay. And we are done. You're done, guys. Break po. Walang na break, tapos na po tayo. Hindi na need ng break dahil tapos na po tayo. So far, may natutunan po ba sa ating 2 nights ratio? Thank you po sa inyong lahat. Yes. Thank you po sa inyong lahat. Magtatap na lahat. Papasa na lahat. Magagaling lahat. Ang tips, mag-pray. Shout out po kay Mariname Alain Madera ng SSU. Let's go! Thank you guys, napaka-participative niyo po. Kayo po yung section na nahawakan ko na hindi po. Ma'am, after boards, confident ka ba na magtatap ka? Happy birthday kay Lisel Gomez! Happy birthday! Confident ako na papasa ako, pero hindi po ako confident na magtatap ako. Pagkalabas ko po ng testing center sa Cebu, sabi ko sa sarili ko, thank you Lord, RN na ako. Sabi kong ganon, kasi confident ako na papasa ako eh. But, hindi ko naiisip na magtatap ako. Birthday din po ni Aloha Campo. Happy birthday, Aloha Campo. Magtatap ka dahil birthday. Mampabati po kay Bea. Paglabas mo ng testing center, sabihin mo sa sarili mo, thank you Lord, RN na ako. Ma'am, ano pong mas mahirap? Recalls or actual? Parehas lang. As in, pagkabasa mo ng question sa board exam, ang una mong sasabihin, ay familiar. Ay familiar. Kasi yung lumalabas sa recalls nyo, sa pre-boards nyo, yan na po ang board exam, guys. Kaya kung pumapasa ka dyan, papasa ka na sa board exam. Formality na lang, RN ka na. Ma'am, pa-shoutout po kay Nelly Solano. Ma'am, pabati po, si Jane. Pag silabasan na kayo, may ibang klase pa po ako. Para ma-conserve yung energy ko, guys. Thank you, guys. J-Lord, as in Char, ma'am, ano safe na score sa recalls? 70 above. Pag nakaka-70 above ka na, guys, safe ka na. Pero one month pa kayo, ha? Wag maging kampante. Araw-araw pa ding mag-aral, araw-araw pa ding mag-review. AG Villarreal, birthday, happy birthday. Happy birthday sa lahat ng may birthday. Bye-bye, Ma'am Lo. Bye, guys. Thank you for the 2 days rush show. Pabati po kay Aubrey Ayoste ng UP Manila. Ito ni Ma'am. May next class pa po kami at 8. Uy, huwag kang ganyan. Kaya na to be revision. Na mag-overrating na po niya. Pabati po kay Generous Ramiro. Sir Ron, nandyan pa po ba? Different po ba yung link ng second class po, sir? Sir Ron?
Yes, ma'am. Wala po.
Yung next class ko po sa 8 p.m., different po ba yung link or mag-i-stay po ako dito?
Apo, nasendan ko na po kayo ng link.
Send na po? Bago po yung link?
Apo.
Okay. Sige. Thank you, Sir Ron. Mag-leave na po ako.
Thank you po, ma'am. Bye-bye po.
Thank you, sir. Bye-bye. Thank you, guys. Bye-bye po.